able to join us. So again, we want to have something available for them. Welcome back, Dr. Trish. It's great to have you.
Thank you. It's always great. And yes, I think the Zoom will be great.
Yes, I'm looking forward to that. And you're also going to see the number of many pictures that we have of you in action, so to speak. So let's get the show on the road. Before I actually start to fire away some of my questions here, I'm going to give a brief overview or a little biography here for Dr. Trish. And this is just a very short list, of course. And I'm going to try and move our, let's see here, video up here so people can see. I don't know if they'll be able to see everything, but we will at least try. So again, welcome everyone. Dr. Patricia Kallenbach earned her bachelor's and master's degrees and a doctorate of veterinary medicine from the University of Florida. So she's now down in the heat, and we were just talking about that before we went live at how hot it's been down there.
I love it.
Yes, I know. We've had conversations too about you coming to Montreal and how cold it truly is. All right. So now, after graduating from the University of Florida in 1993, she worked for several years in a conventional veterinary practice before opening her own holistic veterinary practice in 2002. We're going to look in more detail. We're going to talk in more detail about her holistic veterinary practice. This new type of veterinary clinic offered integrative veterinary care and many alternative therapies, such as veterinary orthopedic manipulation, myofascial release, homotoxicology, acupuncture, therapeutic nutrition, frequency-specific low-level laser. These had not been available to pet owners living in the Nature Coast area of Florida. This is where her clinic is situated. In 2011, she relocated her practice, The Healing Place, very appropriately named, to a larger facility in Crystal River, Florida. She loves to share her knowledge. For those of you who have been with us for years know, this is, I believe, our 7th year, Dr. Trish, that you have given us your time, which we are very grateful for, by the way. You do have a very busy practice, so this is an excellent venue for her to share her knowledge with us. And all of these different holistic therapies and what she has available at her clinic. She has many published articles and videos. If you go to her website, we will give you that information as well. There's lots of great information there. She teaches seminars for other veterinary professionals. She also gives free lectures several times a year for her local clients, clubs, and rescue organizations. So thank you again, Dr. Trish. My first question for you, because we all know that you are trained through the regular programs, of course, at university. As a conventionally trained veterinarian, what led you to become so heavily involved in holistic pet care and alternative medicine for pets?
You know, for me, it was almost a natural transition. You know, as you say, I got my bachelor's and master's. That was in nutrition, in animal nutrition, before I went to vet school. So I had already really embraced using nutrition in a variety of ways when I stepped into the medical field in the veterinary world. And so as I had been practicing for a handful of years and then started reaching out, not necessarily to stop practicing conventional care, but to just add more tools to my tool belt. And so I added my chiropractic care, which is the veterinary orthopedic manipulation, and I added the acupuncture and things of that nature, and I just kept building on that. So it really was just a natural evolution. As a child, we lived on a farm in the middle of Kentucky with literally no veterinarian in our county. And so I grew up with us having to reach outside of the box to figure out how to provide healthcare for our pets in some really alternative ways. And I always tell people, when I was 3 years old, we had this little calf. My dad had given it too much antibiotics. He had pretty much killed every organism in its body. We finally called a veterinarian. They came out, and his solution was he went and got healthy feces, and he tube fed it down the calf. And he said, yeah, she'll be fine. And I can just remember to this day being so amazed and kind of going, I've got to know why that works. And you know, and that's, I was 3. I can remember it to this day.
Well, the rest is history, as we always say, right? You know, because you do share so much from a scientific perspective, and the fact that you've got both the conventional training, you've got the science behind that, but you've also been curious about the other modalities and really incorporating everything together, the holistic practitioner, that is really your one-stop shop, so to speak.
Yeah, it very much is. And we jokingly, of course, I have my my people side, so now it's a whole family one-stop shop for the people and for the pets.
Well, yes, and you've extended that, I know, because you do carry the human products, and I do believe you also carry some of the equine products in your
We have a
practice.
stable that we work at as well. We have a full therapy setup where we do the adjusting and vibrational and laser and everything at our stable. So yes, we carry the equine products down there. We carry the canine feline products in my veterinary practice, and we carry our human products in our people practice.
That's wonderful. Now, when we talk about, starting at the beginning, and I always love to hear about how practitioners get started or start their journey, because we're all on our own journey, and having you come on to be interviewed is really helping to share, especially when we look at the fact that animals, well, they don't speak to us like we normally hear people speaking to us, but they show us in different ways that there are things that are maybe not in a balance or homeostasis, I guess you could say.
Yeah, and sometimes we just have to go back to the basics. Here's where how the stomach works. Here's how, if everything's perfect from mouth to anus, here's how everything should happen. And if those things don't happen appropriately, what could we possibly see as ramifications? And so sometimes we have to take the known fact of how organs work, lead ourselves into, if that didn't work, what could happen, and then kind of go backwards and now say, okay, but I'm seeing this in a pet. Let's double check that this underlying background thing is not happening that could be contributing to that issue.
Perfect. Thank you very much. Now, in addition to your formal veterinary training, which modalities are you certified in? So we're going to go to town here and get a lot of great information.
Yeah, so I'm certified in the veterinary orthopedic manipulation, which is an instrument-based animal adjusting technique, certified in animal acupuncture through the Chi Institute just north of here in Florida. And they carry I've got an herbal training with them as well, but I did not follow through with all the certification for reasons we'll discuss later. I am trained in our laser. There is not a formal certification in the veterinary field because it's a human-based laser. What else do I have? My myofascial release I'm certified in. My homotoxicology I'm certified in. That was actually from a company in Germany, and that's a human certification, but I blended that into my veterinary practice again because they don't offer a veterinary. And a lot of my training, I took human courses because they just didn't have veterinary training. So I'm a licensed massage therapist. I'm a functional stability specialist. I took more athletic nutritional courses in that because they don't offer it in the veterinary world. That I got certified in that. So, it goes on a lot.
I guess the question should really be, what don't you do?
Yeah, I don't do surgery. I've retired from that. I just decided there's a lot of well-qualified vets around for them to do that part. So they refer into me for me to do my specialty. And I let the conventional vets do all the basic stuff that they do.
That's wonderful because you've got a go-to practitioner in your area depending on what area you want to focus on.
Yeah. And not only that, it's when you work it right, veterinary practices are very stingy with their clients, potentially rightfully so. Money that's spent on a pet is excessive, is money that's free to be spent. It's got a fixed amount that they can do, and so the owner has to really choose where to spend that money. And so veterinarians classically go, well, if I refer them out for something else, they may stay there and do all of their veterinary care there because it provides this one service. And even when I was in my mixed practice, if I had a client referred in for my adjusting or my acupuncture or whatever, if I felt they needed something conventional, I referred them back to their practice to get that done. And I let that doctor know. So the doctor recognized they kept their client and they were only referring them out for a specialty. And over the years, that has really been an incredibly powerful tool that you can work with fellow practitioners and they don't feel that they're going to lose their client. Instead, they're gaining respect from their client by saying, here is an additional modality in our neighborhood that might benefit your pet that potentially conventional medicine can't. So I really do encourage people to keep slugging it out. You'll get the people that hate you. You'll get negatives. For my first probably 5 years, people found me off the streets. They did not get referred from their veterinarian, but I found out who their veterinarian was, and I sent a thank you for your referral letter to every single client and for this, and letting them know, and I will forward you complete records so that you have complete records of what the additional care your client's getting. And it got to be that I would send a letter, and that veterinarian would refer me 2 or 3 clients in that next month.
Well,
And then it would fall off and I'd do it again, but it just built.
Well, it's all about the professionalism, and you already answered basically what I was going to ask you next about taking us through your journey from, you're conventionally trained to start with, and then you go through these changes and adding all these modalities. Initially, were you seen as, what they say, the witch doctor, or, the woo-hoo-hoo-hoo kind of stuff?
I still jokingly say I'm the voodoo vet. I'm okay with that. I'm good. But yeah, even in my own practice, I was in a 6-man practice, and it was quite hostile with the orthopedic manipulation training. That instructor would say, if you're really having a bad day, you've learned this, you're back, you're getting all this negativism, call Trish and talk to her about her day is. She's not going to fix it. She's going to tell you how bad her day was, and you'll feel so much better about your day. that how much just negativism I received from my own practitioners in my practice. I mean, where clients would come into the practice and get told, here are your options, not including my services. And I'm a long-term associate of that practice. They would leave, and sometimes weeks or months later, they would find out about some of the services I provide, and they would come back to their own veterinary office and go into the exam room. And their first questions to me were, well, how long have you been doing this? Oh, 5 years, whatever. How long have you worked here? Oh, 10 years. Why wasn't this offered when I was here 3 months ago? And it's very challenging to figure out a way to say, I was not there. I cannot tell you that. Because they aren't trained in this modality, that practitioner, even though they work in my practice, they may not understand all the things that this modality may address. And so if that person didn't think it would help it, of course, they're not going to refer it. So I'm sorry for the time lapse, and just move on, because we have to build relationships, not tear them down with our fellow veterinarians.
I completely agree. And you would have to have a thick skin as well, doing and going the route that you've gone, I would imagine.
Oh yeah, you just have to laugh it off and go, yeah, whatever. That's fine.
I wonder if you could touch a little bit upon homotoxicology and explain a little bit about that, what that references to and what that's all about.
So it is a version of homeopathy. Homeopathy is a classic training, and what it is based on is that a strong stimulus of something causes one thing in the body, and if we do a dilutional and succussion of that, we get the opposing frequency in that remedy, and that resolves that. So if you think of a sine cosine curve, the sum of those two curves is a flat line. That's homeostasis. So the basis of homeopathy is, what is the frequency of what's wrong with you, and what homeopathic is that opposing frequency, so that when we add that homeopathic to the mix, the sum in your body is that flat line, that homeostasis. Homotoxicology went a step farther after homeopathy had been around for probably a few hundred years. Dr. Hahnemann, who was integral in this development, basically looked at our illnesses and our conditions in our body are getting too complex, and there's just way too much going on in the body to try to narrow it down to one remedy and then treat that for a time and then treat again and treat again. And so homotoxicology is about using our same homeopathics, but using them in a combination manner to treat all of the toxic effects happening in the body at the same time. Now, it does take some training and really some brain power, because we have to recognize that we have depths of problems going on in the body. With classic homeopathy, we go to the deepest and we treat it first. And then when we've got that balance, we move to the next. With homotoxicology, because we're treating all of them, we have to really be able to understand, what is that surface symptom that I'm helping? So it may not be apparent the next time I repertoire, but I know it's still there. So there's just a little bit more of keeping in your mind the order with which, even though you're treating all of them. And Joe Deemer's a great practitioner here in the state of Florida, is a wonderful classic homeopathy. and we would always get into, but you're covering up that surface treatment. And I would always say, I have a great relationship with a pen, and I write it down, and I remember that I've done that. So I do keep that remedy in mind, that I've helped ablate that symptom and resolve that symptom, but I recognize that's a surface symptom based on some of the deeper things I'm working on. So I just have found it a wonderful modality. And again, they don't teach it in America. They teach it in Germany, and a couple of other places around the country. Now you can get it online through Heal. And it is, but it's a human-based training. So you do have to lead yourself into, how does this relate to the people, to the pets? And I always jokingly say, you go through the geriatric and you go through the mental chapter of it. And I go, you get through that chapter and you're like, I think I have 2 or 3 of those conditions. I'm pretty sure, I've got those, but it was a very in-depth training.
Now, coming from, I have to ask this question because you've come from a science background and everything's factual. You have to see it. You have to see, testing done or clinical studies and things like that. With homeopathy, and we're looking at homotoxicology, what do you say to people who may come from a science-based background or not? Well, there's no science that proves the homeopathy. Now, what would you say to someone who's a naysayer or a non-believer?
On the first front level, I can say, if you give a remedy to a pet or a child, an infant, and they get better, I could not have psychologically talked them into mind over matter. This little magic remedy is going to make you better. If it works, it works. And so certainly in the veterinary field, if we get it right and it works, it's working. But additionally, at least in my training, they literally went back to the biochemistry of the body. Here's the functions in the cells we feel are not working. And because those functions failed to effectively work, here's the symptoms we would see in the body because that functionality is not working. And so they base a lot of it on that. Now, it also is based back on the clinical studies were probably pretty horrible in that, back in the 14 to 1600s, they basically probably handed a homeless person or a street person, here, chew on this. Okay, well, heart attack. Yeah, okay, that's the symptom. So now we know what the dilution will. So it was probably not such good studies in the back. And they were anecdotal. And that's the other issue that we have troubles with in the conventional world is, if you present 100 pets or people for diarrhea and you're testing a medicine, you give half of them the medicine, you give half of them the fake medicine, and you see what happened. The problem with homotoxicology is you bring 100 pets for diarrhea. I may find 10 different underlying causes for why that pet has diarrhea. And so I've got to treat those 100 pets 10 different ways. And so what ends up happening in long-term studies is that veterinarians or human doctors will document very precisely what they presented with, what they broke it down with, how they treated it, and then over years find an acceptable number to be considered a statistically relevant case and group all those together and say, here is a study, even though it's anecdotal and it's got a 10-year time frame. And the feedback on that is there were too many variables. And I always challenge people back to say, if you put that pet or that person on a medicine, what's their blood pressure? What's their metabolic rate? What food are they feeding? What other underlying diseases do they have? What other slight imbalances? Are they exact replicas of the thing? Are they living in the exact same circumstance? Or are they living in people's homes and all of those are different? Do they have similar pets or do they not? There are tons of variables. It's impossible to avoid variables in our studies. And so whether we have to tighten in our P factor, which is our statistical factor of how much variation we can have, or whether we have to just use larger population studies to overcome that, either of those can happen. But the scientifically relevant person that says, see, this works, I can poke 100 holes in that. And I've worked in immunology research labs. I've worked in pathology research labs. I have the research to back that up, to go, here, let's look at it. Let's go where we are. And then they'll kind of go, yeah, okay, maybe not so much.
Excellent. Thank you for that explanation. Very much appreciated. Starting on the right foot, we all want to do our best by our pets, of course. I know many pet owners are they're coming to you because maybe it's a last ditch effort. Maybe they just are educating themselves. There are other options. What do you consider to be the three most important things that we could do to start off on the right foot?
And the basic things are really stuff that I have to do them before I engage with the pet, because we have to look at what is that pet eating. If that pet is eating garbage food or imbalanced food or whatever that could be contributing to the burden on the body, okay, let's resolve that. Yes, can the pet digest it? All of those other gut supports are along with that. But we can take a million supplements. And I've had people walk in with my pet's on the best food in the world, and then they bring me a cardboard box full of supplements that their pet has to have every day. I'm like, how can that be the best food in the world if you got to put that much crap in their bowl to keep your pet healthy? So, let's re-investigate that and see what's going on. Secondarily, they've got to have a positive environment. If they're living in a hostile environment, even in our cats live independently. I'm sorry, if you own 8 cats, your cats are in a hostile environment, and we've got to do some things to change that home environment to just help that pet deal with that stressors. If you've got 2 pets and one just really is the boss and is nipping at the other all the time, we've got to address that. If you've got a person in the household that's aggressive and doesn't like them or whatever, if you've got smokers, if you've got lots of stress in your home environment. I tell people the story that years ago, I had this little Dachshund that was referred to me for intervertebral disc disease, for crazy pain and spasm from a compressed disc. They had done all the medicine they could do. It wasn't working. So I came in and I did some acupuncture and herbs and homeopathics and adjusting and all of this stuff. And the dog was doing great. And we were on our road to recovery. And about 3 months out, the dog was right back to screaming pain. Okay, it's a little Dachshund, they can have flare-ups. So they brought the dog in. I did all my magic in. I sent it home. 3 days later, it was right back to it. And so I called and said, I need you to come in, and I need everybody in the house to come in. And so it was just a husband and wife. And so they all came in, and it was an only pet. And I sat down and I said, what's going on in your household that's creating so much stress that this dog's muscles are in such spasm, it's recreating this pinched nerve? I got to know what's going on because I can't feed that. And the woman had just been given a diagnosis that she potentially had cancer, and they were waiting for diagnostic results. And I was like, okay, well, here's some Valium. No, you can't share it because that's from your vet, but we're going to have to use some chemistry to calm this pet down and stop this muscle spasm. And once all that's calmed down, then we can start rehabbing it, because your pet is feeding on your stress. And so we have those circumstances that we have to look at. So we have to make sure they're on some reasonable nutrition that's right for their body. We have to make sure they're in the best home environment we can. And then we have to look at what are the day-to-day chemicals they're being burdened with, and whether that be their flea or tick, their heart rhythm medication, other conventional medications that they need to be on for other health conditions. We have to look at those 3 things before we start moving into, okay, what are the things that we can do? Because sometimes we need to look at how can we modify those to decrease the burden on the body before we can start looking at some of our other modalities to help.
Well, too, and I know we've discussed this in previous interviews, that you like to take your time with your clients and not just, rush them through the door. And I know in a lot of veterinary clinics that it's like a rotating or revolving door, and you don't get that time, that I guess you could say that the appropriate time to be spent to ask these types of questions to really get to the core of it.
Yeah. And even when I was practicing conventional care, I tell people almost proudly that the technicians point blank told me they hate to be the technician for my room because I took too much time in the room. And I always told my staff, I'm not fixing their pet. I am teaching that owner how to fix their pet. And whether it's a medicine or a supplement, they need to understand how it works, why it works, what could inhibit it working, and all of those understanding things so that they go home and make that modality work, whatever it is. And whether that be I just fixed your dog's broken leg, I need you to not let it run and play because it's on enough pain medicines it doesn't know it's hurting. Or whether it be, I need you to understand that a homeopathic absorbs through the mouth, so the mucosal membrane, so I don't need you to squirt it to the back of the throat or mix it in food. I need you to get it in contact with the surface of the mouth. Both of those are very important for the success of that technique on the pet.
That's perfect. I really love your philosophy on that, spending the time. It's like teaching someone to fish, whether having them rely on someone else providing the food for them, kind of thing,
Right.
that kind of idea. Okay, now I love this photo of you. Those puppies are absolutely adorable. Now back to the important message, and I know there's so many things that you like to educate on, and it's difficult to really pinpoint one. But with regards to the holistic approach, which is a completely different animal, no pun intended. Well, maybe it was, but um, when it comes to the holistic approach versus the conventional approach, what is the most important message that you try to get across to pet owners?
Really endurance. We've been brought up in conventional care that here's a pill, the problem's going to go away, call me when you need me again. And we have to recognize that that pill is potentially, it may be resolving the issue because it was a temporary issue, but more commonly it's just masking the symptom. And so we need to understand we may use those modalities to mask the symptom, but we've got to get to the underlying symptom because and start resolving that, supporting that, whatever we can. So it's really resilience. And I have had people that come in and at the end of my whole spiel, they're like, well, crap, I just wanted a pill to make it go away. And I literally go, let me refer you to a conventional practice in my area. No disrespect. We've all got to find the modalities that work best for us. And if that's what you're looking for, holistic, I just don't want you to be frustrated and give up. It's just not what you're ready for right now. And I've had people drag their spouses, friends, siblings in for, oh, you've got to try this. And the people just don't want to give it the effort. It is a lot of work. And if they're not committed to doing that, or if their lifestyle is just not such, if you're working 12-hour days and have 3 kids and all of them taking care of a spouse or a parental unit that's incapacitated, there are a lot of things in our life that, as much as we love our pet, pet is on the low end of the totem pole, and we just have to accept that that's a real thing. And so what we have to do is what we have to do.
Now, with regards to education and educating on expectations, because again, for people who have gone the conventional route their entire lives, they've had pets all their lives, and now this is a brand new way of looking at things, that would, I think, be a big jump too for many pet owners, getting their expectations in check kind of thing.
A lot of times it's not, because I always started with back to here's how this organ system works. And here's what I think is going wrong. And here's where your conventional medicine has been, what it's been doing. And here's what we're going to try to do to try to support or resolve the situation. And people go, oh, they're not going to take the time to understand. They don't want to. Sometimes I do talk my clients into a coma. I got to admit, sometimes they are just overwhelmed with information. And I really have to work on every day limiting that. But if I can keep it to the basics of just 2 or 3 ideas, but explain to them, because a lot of times they're coming to me because they're already frustrated with that rinse and repeat technology or medicine that they've been getting from the conventional. And so when I break it down and go, here's how the body works, here's what I think is broken, and here's what I think we need to do about it, a lot of them are on board. They're like, okay, that resolves so many things, that explains why things haven't worked. It makes them feel better about their past veterinarian, that they were just doing what they were taught in vet school and in that, but it didn't get to the base of the problem. And that's why it came, because so many people do sadly go, the vets are just in it for the money. And they gave me these pills last time and it worked, but it only worked until I needed it again. And then they just wouldn't give me more pills. They needed me to come in for the evaluation. And that's just an extra 50 or $60 for their pocket to then give me the same set of pills. And so they do create a fairly negative relationship with their veterinarian. And when I sometimes sit and just talk them through, here's what's going on, here's what that was doing, here's why that conventional doesn't address that, let's go about it this way and see if we can. We may end up still needing a little bit of that conventional care to kind of icing on the cake to get to full capacity. But here's where we'll get to a much better circumstance. And they really, I mean, I get so many in that first visit that's just like, that makes so much sense. I now so much understand what my pet's going through, and they're on board with it.
It's an aha moment, that light it triggers, and then the rest is history, because again, they've started themselves or their pet on a new journey to health,
Yeah.
really.
And I mean, even something as simple as diabetes. I mean, I just had an elder couple that came with their pet, and their vet was doing the right things, running the glucose curves. It was still too high up the insulin. Run the glucose curve. It was still too high up the insulin. But because they weren't taking the time to understand it, they were simply getting a $150 bill every week. and their pet was still peeing too much and all over the house. And so they didn't understand it. And literally I came in and I said, here's what's going on, and here's why the pet's peeing too much, and here's why we have to do it, and da 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 da. By the way, let's get your pet off of grain-based food, because that's all simple sugar, and we're trying to deal with simple sugar. So let's kind of address that, and let's support your pet's pancreas, because if one side isn't working, the other side's not working. But here's why it's good. And they still have to come in for their glucose checks and changing their insulin and all that stuff. But now that they understood it, it was like, oh, okay, I got more information in this 15 minutes than I did the last 3 months going to my vet.
That's incredible. And we are going to be looking at diet and how nutrition is linked to canine and feline health a little bit later on. But thank you for sharing that. It's all good. A thumbs up. And I know we all have, I always say we all have good days, and then we have days that aren't so great. But, you know, we can tell because you are so passionate. And now that we can see you, we can see how passionate you are as well, not just here. But what do you enjoy the most about following a holistic approach to health for the animals?
You know, really, whether it's egocentric or not, I just get a living kick out of fixing things people can't. When we get those really complex problems, and the vets have done the best they can with conventional care, and they're ending up with at my doorstep with, I've just got something that they have been telling me this is as good as it get, or I need to, you need to consider euthanizing my pet, and I can turn that pet around. It is just amazing that to just be able to provide that, not only the knowledge to that owner to understand what's going on with their pet, and how they have the ability to control their pet's quality of life. And, you know, and you'll get the ones that aren't, but it's amazing. And I mean, I just had a cat that incredibly inhandleable cat. They literally brought the cat in. They had to syringe the cat to even touch it. They ran all the blood work, and they sent it home and said, you've got a diabetic cat, and you need to start giving insulin injections twice a day to a cat you can't touch. Now, it's a lovely cat in her house, but she can't cuddle up to this cat. There is no way giving this cat insulin is going to work. So she's left with, my cat's either going to die of diabetes, or I have to put my cat to sleep. And she shipped the blood work over to her, and I did a consult, and I said, I don't think this is diabetes. I think this cat's blood glucose was so high because it was stressed out of the max. And I had another internal medicine went, you're right, that's insane. Don't do that. The cat has pancreatitis. We changed the food. We added some supplements. And she checks the urine, so she can check the urine. And now the glucose is negative. Okay, your cat's not diabetic anymore. Your cat just had pancreatitis. And if one part of the pancreas is screwed up, the other part is affected. And now the insulin can't find the outside world. And so the glucose goes up. And you know, and now she's got her cat that she loves, even though it's not a cuddle cat. And I never see the cat because nobody can handle the cat, but we manage it over consults. The cat is glucose negative in its urine, and the cat's doing great.
What a relief, though, she must have felt after that.
Yeah.
You know.
And you know, and again, still very, very angry with that. That's the first time she ever saw that vet, and that was the impression. I have to kill my cat, because I can't do this. You've given me a knowingly impossible treatment to do. And, you know, you get the little or the big dog that doesn't like its teeth messed with and its mouth messed with, and go, here, you're going to have to force this pill down his mouth twice a day. Yeah, that's not a relevant thing either. And sometimes we just don't, as a veterinarian, I sometimes feel we just don't take an in-depth approach, whether it be that owner has problems. I've got a client that's a post-polio survivor. He has some limited dexterity in his hands and things. And so there's limited things he can do with his pet. And so I make different recommendations based on the owner's capabilities as well as the pet's capabilities and problems. And we just sometimes don't do that.
No, it's perfect. And for that, you would need time, because that's something you cannot do in a very limited amount of time. So this is back to your philosophy about spending time and getting to the core and asking the questions. So I like that. Now, as all of us understand, I'm sure you have some days that aren't so great either, but with regards to more difficult things that you encounter, maybe you could explain that to our group this morning.
You know, some of the things are what we've already reviewed, whether I look at it and say, you know, here's a course of action, but I just don't think this is going to be within your wherewithal to do. whether it be cost prohibitive or whether it be the ability of what's going on in the household to do. And so that's always difficult to just be able to have to say, I understand the course that I'm going to recommend is probably not going to fit in with your scenario. So what's the best we can do? How can we marry what we can do together with what you can do, our recommendations with it? To some degree, that's always happening in veterinary medicine. You know, we present the bill of $5,000 and the client says, I have 300. And so we sometimes have to figure out what we can accomplish within our range. Sometimes that's a much bigger task in the holistic form, because it's not just down to money, it's down to what the owner can do. Sometimes it's back to those expectations. You know, they've heard, you know, you did this for my pet and for my friend's pet, and they walked again. And I did have a client that came to me with a dog that had been paralyzed for a year and in a cart. And she came to me and said, you know, I just talked to a friend and her dog got paralyzed last week and you did an adjustment and it's walking again. So can you do that for my pet? Okay, your pet, number one, each paralysis is a completely different thing. It's not always the same thing. And we don't know how many cells have been injured and traumatized and how much so, and can I rehabilitate them versus are they permanently damaged? But your pet's been in a wheelchair for a year. So this is a completely different approach. And so sometimes we do have to control their expectations of what we can get out of this. Allergies are a perfect example. I don't fix allergies. I don't fix irritable bowel. I control them as best we can. And there's going to be a lot of factors outside that factor that. And so we're going to have to tier our care throughout the months of the year based on what the season is and what the triggers are.
Perfect.
So there's a lot of just complaining. By the way, I did get that dog out of the wheelchair. So it did fine.
Oh, good. Excellent. Well, because I know that you, this is the thing about Dr. Trish, is if you don't know the answer right off the bat, I'm sure you'd be researching it or looking into something that you could use to help that particular animal. Like that's something that for you to say no and throw your hands up, you would have had to exhaust every opportunity, I would think.
Right. And I mean, we just had a bully breed presented with this ataxia of the rear that was diagnosed at the University of Florida without any diagnostics, because you can't biopsy the spine, with a fatty plaque depositing condition that gets on the spine and screws this up. And there's nothing you can do about it. Very young dog, like 1.5 years of age.
Oh.
And they're just saying it's going to decline. There's nothing you can do. And I looked at it and went, well, number one, let's tune up. So let's kind of reset the breakers in the back. But number two, if this is a fatty deposit thing, how about we do a supplement to speed up the liver? Because it's what gets rid of the fatty waste products in the body. So if we can speed that up, maybe we can get some resolution. And we did an adjustment. We also like to do things one at a time. If you do 10 million things and the pet's better, you don't know which one helped the problem or which one helped which part of the problem. So we do try to tier it in steps to so that we can get a very clear picture and it doesn't overwhelm the owner. But we started off with an adjustment and he's already walking better. He's climbing steps, he's whatever. And I mean, this dog had a drunk butt off his, he could walk, but he had no idea what his back end was doing. He was crossing over and all of that stuff. And now the dog is walking. He's not crossing over and tangling himself. He climbed 3 steps, from the first adjustment. So we haven't even gotten to, can we clean out the liver? That was just, can we tune up the nerves?
Excellent. Baby steps. That's a perfect example of that. Thank you. The importance of supplements. So I know this is where probably, and I know for those of you, and we will address your questions at the end. I failed to bring that up initially, but you can bring all your questions to the table at the very end, and we promise that Dr. Trish will do her best to answer them. But before we get to that, this is the part I know, and we're really doing a focus more on allergies today. We have focused on different things in the past, but perhaps Dr. Trish, you can explain to the group what goes through your mind or what the process is for your supplement choices for animals with allergies.
So I explain to people that there's 3 factors we have in our control that we can have impact on that affect how allergic our pet is. The allergens get into the pet's bloodstream, more the dog than the cat. Dogs, we really don't see upper respiratory histamine reactions. We see more systemic. They're a scent-based animals, so there may be some impact behind that. Cats will get rhinitis just like we will. But when those pets get exposed to an allergen, it is leaking through their gut. It is getting into their bloodstream for their receptors to see it and go, oh my God, you're not supposed to be here. I better attack you with histamine granules through inflammatory bowel. And so that's where we back up and go, let's make sure the food is not causing it. We know that wheat, corn, and soy are poorly digested and fermented a lot in the gut and set up a lot of irritable bowel that can set that up. So let's look at what our food is doing. In classical medicine, we just go, well, let's feed them a protein they've never seen. And that's right, because they haven't seen it, so they're not allergic to it yet. It takes about 6 months if you leave the leaky gut intact for them to be allergic to that, which is why there's 9 million flavors of pet foods, because we start them off with chicken and then they're allergic to that. We put them on beef and then we put them on lamb and then we put them on fish and then we put them on kangaroo, and soon we're going to have gerbil and quail, because it takes about 6 months. And with food allergies, they can start as early as a year and a half. So we will run out of food protein sources long before we will resolve that pet's issue. So instead, I go back to, well, what can we do to resolve the leaky gut? Yes, let's put them on a food. My rule of thumb is the first 2 words had a heartbeat. I don't care if it's gerbil or giraffe. I just want more pet animal in that pet food. I don't want any wheat, corn, and soy. I don't care about the grain free or not. Those particular grains are poorly digested and create inflammation in the gut. And I don't want byproducts. I always add in the probiotic 8. I love the probiotic 8. Pretty much every pet in my life is on probiotic 8 in my clinic. And I like it because of the combination therapy, that it's got some herbs that calm down some of the irritable bowel. It's got the top probiotic organisms that we need to repopulate the gut. It's got the apopectin and psyllium so that we can do some of the colon cleansing part. And it has some of the digestive enzymes, really for mouth health more than helping the pet digest. But when we have digestive issues and we're not making enough enzymes, they don't excrete those enzymes into the mouth. We don't keep the biofilm clear, and those pets develop more dental disease. And so those pinch of the pancreatic enzymes in the probiotics are actually helping the front end of that intestinal tract in the mouth. And so they all go on that. Then we start looking at, they're on a good food, how much are they pooping? Do they need a digestive enzyme? So we get the gut resolved as best we can. Then we look at the liver. What do we need to do to help the liver to detoxify and excrete the waste products? Because that's how we get rid of histamine. And there's a variety of things to do for that. And there's different things. If the liver values are already elevated, now we've already got diagnosed stress of the liver. So picking up the hepato-VM or the liver tone to help with antioxidants to calm that down. But then there's other nutrients to go, can I just help the liver biochemically excrete out its waste products? But then we want to look at thyroid, and it's so overlooked, particularly in young dogs, because vets say, oh, thyroid doesn't hit until they're 6 or 8. I'm like, no, thyroid has clinically been shown to start being diminished at a year and a half. You guys just treat it as allergies for a half a dozen years before you bother to pull the test. And then I interpret the thyroid differently. Because it's breed specific, age specific, size specific, there's all kinds of things. When they say the range is 1 to 4 for all dogs, that would be kind of like my doctor saying my body weight is okay if it's anywhere in the range of the human being, which is about 96 to 296. No, I'm not going to be healthy at 96 pounds. And no, I'm not going to be healthy at 296 pounds. The thyroid really has to be addressed in that same way. And so, going through those 3 things that we have control of, and so that we can at least lessen the amount of allergies that pet has, then we can look at, okay, fine, we still have an allergic pet, or we still have a pet with inflammatory bowel disease. And so we've got it as controlled as we can. But now when we pick up, whether it's the Benadryl or the prescription Apoquel or Cytopoint, now we've got so much less of an amount of allergic symptoms to help ablate. We just find that those conventional modalities work so much more effective because we're not trying to stop an erupting volcano.
And you probably find there's a lot of skin and coat issues as a result too of allergies, because they manifest through the skin. So you see that, I'm sure, a fair bit in your practice, I would imagine.
Absolutely. And things that we have to look at, again, if the liver can't excrete the fatty waste products, the only other oil excreting gland we have is the skin. And so now we're going to get that rancid smelling oil coming out of our pet, and they're going to feel greasy. And that oil that comes out now supports secondary bacterial and fungal infections. So we get more secondary infections. Their coat looks like crap. All of those kind of things go on. They smell awful, which, doesn't make us want to snuggle our pets very well. Yeah. And I tell people, my rule of thumb for is your pet excreting too much grease out of its skin is that you clean your fingers off, you take your own skin, and you vigorously rub back and forth. And you should not feel anything. And if you do the same thing to your pet and it feels like you've been handling buttery popcorn, your pet is excreting too much oil out their skin. You need to help it do that. and because that is part of the problem. And so again, conventionally, we try to suppress the immune system, and we secondarily treat the infection, and we leave it at that. We wait for it to happen again. And with I look at, we can have effect on how well can we take care of the gut through the probiotics. If we get the pet that is eating dirt, we want to look at using supplements. They're looking for extra minerals. If they've got a gut problem, they may not be absorbing as much in healthy pet food, or they may be trying to fix a deficiency. So we need to pick up, the Nutrify and boost that in. If we've got a pet that's out there eating grass or other plant matters, that's usually vitamin rich. So we need to pick up the Optipet and blend that in. If we've got a little bit of both, okay, we can pick up the healthy pet, the pet vitality. The healthy pet is different because it is a combination of herbs that just boost the immune system. And so if I've got that pet that doesn't get itchy, but they just get flaming infections in every orifice of their body and toes and everything, then I go, okay, we not only need to resolve the gut as best we can, but we need to boost their immune system a little bit. And so using some of those herbs in the healthy pet to boost that up can help that as well.
Perfect. Thank you. I'm happy that you, as you always do, go through different scenarios, because it's all about situational uses and people trying to understand, what are the differences, first of all, and in what situations would I use these different supplements? So,
Right. And
thank
so
you.
many people, they'll come in with saying, I tried this and it didn't work. Well, if you to have a cut on your toe and you put a Band-Aid on your finger, that doesn't mean there's anything wrong with the Band-Aid. Your pet's broken or imbalanced in a different way than some other pet that has the same external evidence, but internally there's different factors going on, and you didn't address it with that.
Yes, absolutely. And this is why we always talk about in the webinars that we're doing about, speaking with your veterinarian. Well, especially when we're looking at someone like yourself. And again, it's too bad you couldn't clone yourself 100 times, because I'm sure people that are listening, and I know that question has come up before, can you please clone yourself and move to Canada?
Yeah, really.
It's not
So,
really that cold, we promise. It's not,
yeah.
well, depending on which province you
I
move
did
to.
just go skiing in Utah, and I had bought new ski wear because I had like 30-year-old ski wear, and I was pleasantly surprised that the new stuff works a whole lot better than my 30-year-old stuff. I was out building snowmen. I was amazed.
Good for you. So there is hope maybe for us. Okay. Quality, safety, and efficacy. What do you like about the Omega Alpha Pet supplement line as a practitioner?
All three of these things. Number one, that there's some, as you said, some research behind it, some minimal clinical studies to show this combination had this result, that you're testing each batch to prove that it's got the same ingredients and the same quality of ingredients in each one. So that's the basics that I put to every. But back to where I talked about that I didn't follow up on my Chinese herbal training is the symbiotic combination herbal relationship is probably one of my favorite things about Omega Alpha, because instead of saying, okay, I need a pinch of this and a pinch of this and a pinch of this and a pinch of this, and I have to send my client 5 products home, what Omega Alpha, I feel, has done a fantastic job with is looking at this product helps with this, but this other ingredient helps the body utilize that, and this other ingredient helps that organ in a slightly different way. And so you get a supplement that has a little broader approach in how it may help the liver or the kidney or the whatever, even if that organ from pet to pet has some slightly different reasons why there's some inflammation going on in that. So it not only makes it to where in that combination scenario, we end up giving a smaller volume to the pet, so it ends up being much easier for that client to administer. It also ends up being more economical to that client owner. And so, and it's less confusing. You've got a kidney problem, here's the kidney thing. You've got a liver problem, here's the liver thing. Instead of going, well, they need some milk thistle, but they also need some of these other products to help this part, and they also need some of these other products to help this part.
Well, it makes me feel good as an employee of Omega Alpha that you have chosen not just one of our product lines, but 3 of them, because I know you're very choosy about what you like to have in your clinic. So that makes us feel good as a manufacturer of these supplements, that you've chosen our line as one of your many lines that you have, that you feel that they're safe, of high quality and efficacious for, only the horses, but people and the small animals too.
Right. And, you know, when you talk about the many lines, I carry 4 lines. I carry Omega Alpha. I carry a few standard process supplements. I carry a company called Health Tech, because that's where I get my digestive enzymes and the support, the excretionary support for the liver. And I carry my homeopathics from Germany. Other than a few random things, that's all that's in my clinic other than food.
Wow. So we are very privileged to
So
be here.
there's not a whole lot.
Yeah, that's good. Thank you for sharing that, because it makes us feel good that, and of course, you know, Dr. Chang, you've met Dr. Chang before, so you've got
Yes.
to speak with the our formulator of the products, which is excellent.
Yes.
All right. The power of food. And I promised that we would get here. This is, and unbeknownst, I think, and this is all part of the education process too, is what you're feeding your pet every day could either be helping or hindering his or her improvement health-wise. So perhaps with regards to specifically allergies, what is the best type of diet? Or maybe you could give us a few scenarios of what you would recommend for an animal with allergies.
So, you know, again, we start off with the basic. I want a good quality food. I want it to have more meat in it than other. I don't want those high irritant, poorly digested grains, the wheat, corn, and soy. I don't want byproducts and waste products in it. I want a better quality. I personally stay away from lamb in the southern half of the United States. Lamb is a great protein. It has essential oils that really help bring out luster in the coat and can help with allergies, but it's also one of the hottest meats to digest. And when you get into Chinese medicine of what's a hot meat and a cold meat, it's really how much enzymes does it take to digest that protein? Because the enzymatic action releases heat. It's a chemical reaction. Lamb has one of the highest enzymatic needs to digest that food. And so we trade one heat for another. So we get rid of the inflammation, but we add some heat of digestion. Again, if you're in Scotland, it's no big deal. Average summer day is 70 degrees. If you're in Canada, no big deal. You get down in Florida and it's 114 in the shade, and you know, Arizona where it's worse, we've got to be taking just that heat of combustion into effect. And so fish is one of the coolest meats to digest, still has the omega-3s that are actually anti-inflammatory to the skin as an antioxidant. And so I'll divert people more towards fish-based foods. If I've got a pet that has a very robust appetite and they really have a great GI, we want those heavy oiled fish. We want the salmons and the mackerels and the herrings and the tunas. They have those fats that do that. If I've got that pet that is that secondary pancreatitis, irritable bowel, really picky eater, sometimes those fats are more than they can digest. And so I have to move them to a white fish, which doesn't have the fats for the fatty acid, but still is an easy to digest protein and in that cooler variety. So we have to look at what with cats. You know, I tell people, you know, you go down the grocery store and you look at the dog food and there's like 6 different types, and you turn around and there's 900 types on the cat. Cats are highly prone to irritable bowel, but they're also very olfactory driven in their appetite. And so if they're a little bit nauseous, they'll want a flavor that overcomes that a little bit. And so you'll find flavor whatever. And they'll eat that for about 3 to 3 days, and then they don't like it anymore because their natural olfactory has desensitized them to that smell. And now that smell is not enough to overcome that little bit of nausea. And so you're on to flavor 497. And that is a common rotation through pets. And so we have to recognize that when we have irritable bowel, I will tell people there's no such thing as a picky eater. Pets will eat roadkill and poop. So we have to look at when they're turning their nose up at what is relatively a good quality food, we have to recognize that as nausea. We have to recognize that as a symptom of the irritable bowel, and we have to work around it. And if we have to choose a simpler food like a chicken or a fish, what do we do when we get the stomach flu? We go eat chicken soup. We don't choose some spicy, crazy, rich meal to eat. We go to a basic food. And so sometimes we'll have to do that. Sometimes I have to add homeopathics on board just to get the stomach calmed down to where they'll eat anything. And I have clients with irritable bowel that they have to stay on those forever. That's as best as we can get them. So we want to start with using those easy to digest foods. Yes, if the pet's appetite tolerates it, we want to get those fish in there, those heavy fishes, because they already naturally have not only the cooling technique, but they have those essential oils that help with inflammation at the level of the skin. We want to add the probiotics. We want to make sure they're defecating small amounts, a third or less of what their total volume is of eating. If we've got that picky eating food, that picky eating pet, we don't want to add supplemental fish oils, because now we're right back to adding a high content oil to a questionable pet's digestive tract. You know, we want to add enzymes if we need to. to. So, food wise, I try to get them onto a fish-based food if they can. Now, when you get into cats, dogs, you change their food. Fish, you offer, cats, you offer a selection and you do exactly what they tell you to do. And they're very tactile specific as well. So when you move into wet foods, which is absolutely preferred in cats, I want at least 70 to 75% of their intake to be wet food. They're a natural desert species. All of their moisture would come from their food. But when we get into those wet foods, we have to look at texture, because you'll have the cats that love pate, and you'll have the cats that love more of the stew and chunk, and you'll have the cats that love it more like a straight chunk out of a tuna fish can. And you are not changing their mind. You can put the right flavor down and the wrong texture, and the cat will just look at you like you're stupid. So we do have to, when we're switching them over, we do have to not only do are they a chicken-based fish or a fish-based, chicken-based cat or a fish-based cat, or do they like the red meats? But we also have to look at texture in our wet foods.
Yeah, so much for us owning cats. I think it's the other way around, don't you think? Okay, I have another question that we get a fair bit, because we have a toll-free number that retailers call, consumers call, about, and this is a question that is very valid. Pet owners calling us and saying, well, my vet never told me to change the diet. This is where we have to find ourselves in that being professional kind of scenario. Why wouldn't my vet tell me about the importance of nutrition with regards to why my cat or my dog isn't getting better? And we have to be careful too, because we don't want to step on the toes of the veterinarians, but it's just about educating in a gentle
Right.
way. But what do you suggest there?
And I do tell people, as a veterinarian, we get little to no nutritional training. And nutrition is not addressed at all. In my 4 years in vet school, I got 1 3-hour afternoon on a Tuesday afternoon of science diet telling me how great science diet was. And having finished a master's in nutrition, when I would ask clinically relevant science-based questions, they did not have answers for me. And so, I tell people that would be like going to your chiropractor and asking them about your diabetes, or going to your doctor and asking about your chiropractic problem. They each have their specialty, and nutrition is not the specialty of your veterinarian. They know a little bit, just like your doctor. We got 3 hours more than your physician did. Do you go to your physician and look at any nutritional stuff? Of course not. And I do on my human side, because, if you're a non-veterinarian and you're offering these supplements, I do tell people, if your pet or person is on a lot of pharmaceuticals, you do want to say, I want you to take this ingredients list back to your doctor of choice, whether it be your own or your doctor. I do not in any way want you to ask them, do you recommend a supplement? They're not trained in supplements. They are going to say no, because they can't rightfully doing it. Not because they believe in it or not, because they're not trained to recommend that. If you're going to do anything and they're on a lot of other medications, you want to say, I want you to look through this ingredients list. And if you see an ingredient that is documented as deleterious as a combination to a condition or a medicine that I'm on, I need you to let me know that. And in the real world, I tell people, take them to your pharmacist, because your doctors don't know. So, and I always use the example of grapefruit and whatever that blood pressure medicine is. I have no idea why you can't take grapefruit and whatever that blood pressure medicine is, but it's not my job to know. So anytime you're adding a supplement, if you're not the physician, or if you are the physician and you're not sure, refer them to a pharmacologist and say, hey, do you see anything in this ingredients list? Forget that it's a dog. We're starting to put pets on blood pressure medicine. In the human version, even if you're not familiar with the veterinary line, is there any ingredient in the supplement that is contraindicated to these medications? And if so, okay, we need to skip that medication.
Good advice. Thank you.
Or better yet, we need to skip the supplement. We'd love to skip the medication, but we need to skip the supplement, and we have to go about it a different way. So whether you're a veterinarian having this discussion, take the time to call a pharmacist and say, because that's what they studied. We don't tell you the problems with your meds. We expect the pharmacist to, because that's their job. And the same thing with herbals, in that if we've got any question, we need to not have pride. We need to call up a pharmacist and say, can I just fax you over these ingredients list? I've got this pet that's on a lot of things. I know these supplements. There are some supplements that have been studied in the human world. Do you see anything, if this were a 40-year-old guy, that any of these ingredients would conflict with the pharmaceuticals I have this pet on? And if not, have the owner do it.
Perfect, because we all want to be safe at the end of the day, right? Do no
Right,
harm is what we're all
right.
trying to do. Now, the last question I have for you, Dr. Trish, before I open it up to our group, maybe you could share a story or two about how you use the supplements, or maybe you can talk about some success stories as they relate to some of the supplements you've used for allergies and
Yeah, I
kinds of
mean
clients.
and literally between my adjusting and the things I do for GI, allergies and lame dogs are my number two, or my top two clients that come in the door, because they're either tired of here, just give them the pain medicine, or they're tired of here's another bottle of X, Y, and Z to temporarily ablate the symptoms. And so we do turn a lot of allergies around. Again, I do take the time to tell people I did not fix your pet's allergies. I did not fix your pet's inflammatory bowel. We have gotten those factors that we can control in control as best we can based on these supplements. And now we need to, this will vary throughout the year because allergens vary throughout the year. And we have to work through this. So yes, some of them we do food allergy tests or other allergy tests. I just did a dog's allergy test and he was literally allergic to every plant I tested him for. Every grass, every tree, every food ingredient that was plant-based, every single plant, plant, not fruit. And so literally I have this pet on a meat and fruit and goat's milk with cranberry only. There is not a single plant, and I don't have them on a single supplement because I can't find a supplement that doesn't have a plant, and every single one. And that dog's doing wonderful. We did some homeopathics. We changed that food. We've added some digestive enzymes. But again, I use the Ultra Pro probiotic, the human line probiotic, because it doesn't have the plant additives. So I've got a probiotic that I can put him on, but I had to find one that didn't have any ingredients of any herbs in it because he's allergic to every plant I could test him for. And he's doing great. Yes, we did make desensitization vaccines. I don't think that's going to be a big part of his recovery because number one, he's already gotten better before those set in. And number two, he was just allergic to too many things for that to be effective. But the owner wanted to do it, so I'm okay with it.
That's a perfect example of using the diet as a way of improving the well-being for sure.
And sometimes, speaking back to your probiotics, those herbs that are calming down inflammatory bowel in there, they're great. But I do have a handful of pests that will blow them out with diarrhea like there's no tomorrow. And I go, you know what? We're all going to be unique. If I put them on a supplement and that pet has a bad reaction to that supplement, there's some ingredient in there that just doesn't set well with that pet. And so I've got to bypass. And so I have my tier of probiotics. If I have that issue, I change over to the encapsulated Ultra Pro your human line so that I can still get them a good quality probiotic, but it doesn't have all those added things. And I go, these are wonderful added things and it's my first choice. But the reality is sometimes that pet is not going to tolerate that supplement. So there are great supplements and there are great diets and all of this stuff, but that does not mean every great supplement or great diet works great with every pet. They're all going to be unique, and we just have to accept that we are sometimes going to have limitations in what we commonly use.
Excellent. Thank you. Well, that was fantastic. Once again, I always take something from these interviews with Dr. Trish, and now I am going to open it up for the group. Now, Dr. Trish, I'm not sure if you can see these. You can see these questions up here on the screen. Can you see anything coming up or?
Now, right now, I've just got I've still got your slide.
Okay, no problem. Stories. I will ask you the question then. Although you are in the US, are there any brands of food you can recommend for dogs, chicken, grain, soy free?
So, Fromm is probably my top line right now. I still think Blue is holding its own and doing okay, even though General Mills bought them. They've held their own. There are a couple that are sold more at our feed stores around here. And those are one called For Health and one called Taste of the Wild. They're okay. They're still not as high as I'd like. Merrick has fallen off the wayside just because Purina bought them and we'll see how they're doing. They've already had several recalls, so sadly that happens. Evanger's is still a great line of food. They do a lot more cans. They started off as a canned variety, and then they've added a few kibbles. And Pure Vita is another really nice line that I have. And a lot of these, the Pure Vita makes another one I think called Natural Source, and they're two lines of the same food. And the main thing you want to look for is single proteins, because when you're dealing with, I know I have an allergy to chicken, my pet is that way. A lot of them will blend it in somewhere and do 2 or 3 or 4 different proteins, and somewhere blended in there will be the one. And so you really, when you're doing food allergies, you really want to find a food that is using a single source protein so that you can put them on that single source protein and make sure, are they good, or are they also allergic to kangaroo or whatever, and move it on. So, but Pure Vita does a good line of single source, single protein source foods. Froms have some, they have both. Some of their Froms are single proteins and some of theirs are mixed proteins, so you have to source through them. Blue has some allergy specific, and so they've got an alligator one. And that scenario, again, I'm not a Royal Canin or Science Diet fan, simply because they left cornmeal in, and cornmeal is such a pro-inflammatory grain. I just can't support the relevance of their lack of study behind it.
Wonderful. Thank you. Have you heard, are you familiar with Farmina from Italy? Have you heard of that brand?
I have heard of Farmina, and I have, I've had some clients doing well with that, and there, where Ruva is another that I think is locally, or maybe that's from Canada, I'm not sure. Ruva, Acania, those are some that are good. And the questions I look at, my 4 criteria, again, the same I've gone over. When you look at the ingredients list, the animal is the first 2 ingredients. In cats, I really like it to be 3 or 4. No wheat, corn, and soy. And in cats, I really don't like any simple carbs because they have a 0 carb need. And then no byproducts. The 4th one is, if you can find out, do they make their own food in their own factory? And that's what puts From and Blue and Pure Vita still at the top of the line. They own their own factory. They only make their stuff. Nobody else makes their stuff, and they don't make anybody else's stuff. So they have complete control of their quality of food.
Excellent. Thank you. Another question, are the homeopathic remedies you use in liquid form?
The homeopathics I use, they come in an alcohol-based liquid form, they come in a lactose-based tablet, and they come in a saline-based oral vial. So they come in all 3. I actually have a remedy copier. And so for some of my more fractious individuals, if I've got allergies and GI issues, I don't want to use a lactose-based tablet because they can react to the lactose in it. And you can't use an alcohol-based product in cats, and you can't use an alcohol-based product in anything that I think has pancreas issues. And so it's a little thing called a BioPet, and it does a very reasonable job of relatively replicating that into a water-based form that I can use. The saline-based forms that I get from Heal are, for the most part, too cost prohibitive to make 4-ounce bottles and send home of when they're in little 1 ml bottles. But I do carry those because I use them for injection acupuncture.
Wonderful.
And so and I can use them for intravenous push if I need some really drastic things going on. One of my own staff members, not a veterinary staff member, a massage therapist, used about 20 times the amount of ivermectin in her dog one day. She used cattle injectable ivermectin for about a 150-pound animal in a 4-pound Dachshund because her neighbor told her to. And so it presented to me with very massive neurologic twitches and everything else. And she came in, and I dropped an IV line, and I'm bringing all this stuff, and I'm just IVing and IVing with all these homeopathics. And she said, Trish was so calm that I realized I hadn't killed my pet, and it was okay. And I was feeling pretty good about myself. And my children were here. And my son walked up, and he was about 12. And she said, I realized I was having that the situation was more serious because your son walked up and started to ask you a question. And you turned to him and said, if you interrupt me right now, you are grounded until you're 25. And I turned back and started doing the petting. She went, at that point, I kind of realized this was a little bit more serious. But I do keep those those sterile saline vials around because I can use it injectively. But I can also manufacture saline-based injectables with my homeopathic remedy maker. It's not as pure. It's kind of like if you took a cassette recording of a true thing, you get that little bit of, it's not as exactly frequency specific, but it gets the job done. Perfect. Time and again.
Thank you. And we have quite a few homeopathic supporters with us this morning. So thank you for going into detail about that and going into the homotoxicology earlier on. That's great. Thank you for the questions, everybody. Does anybody have any more questions for Dr. Trish while we have her? It's a perfect opportunity.
And, as we've said in the past, do not hesitate to drop me an email, refer them to my website. I've got lots of videos and articles and things of that nature. And again, if they've got something specific, they can email me.
Perfect.
And for those that aren't veterinary based, or for those that are veterinary based, I will happily do consults. And we've got a video app. So if it's something that I need you to see my dog or my cat or my whatever, we can, Anapanion is a video app that we can do through. So we can offer advice at distance as well.
I will share that information via email to all our participants today. I am feeding raw to my new kitty, and is it necessary to add supplements?
Depends on the raw. Some raws are a complete well-balanced food and others aren't. And it also depends on the kitty. If you have a kitty that they're always searching out your plants and they're doing this and they're doing that, and they're licking the floor and they're all of that stuff, then I look at your pet food may be a great balanced pet food, but it's not balanced for your pet. And at that point, I'm going to add a vitamin mineral base to them. And if it resolves, if you notice that pica, that trying to consume abnormal things, and you put them on a well-balanced vitamin mineral, full strength on top of their well-balanced food, and that resolves, then yes, your pet, it just has a higher nutritional need of something that another pet doesn't. What's average pet food?
Excellent. Thank you.
Joanne, I'm going to have to go be a
Absolutely.
veterinarian.
Absolutely.
So I will
Thank
see you guys at 3:00. And again, any follow-up questions, drop those to my email and I'll happily follow those up.
Will do. Thank you so much, Dr. Trish. We'll talk again soon.
All right. Thank you.
Bye. Bye, everyone.